Once it streams, yes, it's about to go on. Once it streams, then we'll start. It's trying to stream, and I believe it's beginning to stream. Yes, yeah, yes. That's it. We're online already. And then read the citation, sir. Professor Shoyinka, my lecturer, you're welcome, sir. Olani Beku is here. We are welcome, everybody. Terry, please unmute yourself and then, yes, you can.
Okay. Thank you, sir. Good morning, everyone. Welcome to today's session. I would like to share a brief citation of our guest speaker today, Professor Caleb Kudi. And okay, so Professor Caleb Kudi is from Gombe State. He holds the Doctor of Veterinary Medicine from the prestigious University of Ahmadu Bello University Zaria, 1985. A Master of Science in Veterinary Public Health and Preventive Medicine from the same university, 1989. He holds a PhD in Preventive Medicine and Epidemiology from also ABU Zaria, 1995. Professor Kudi also holds a PhD in Molecular Biology from the University of Leicester, United Kingdom, 1999. In addition, he holds a PGC from University of Plymouth, UK, 2002. He's a fellow of the College of Veterinary Surgeons. Professor Caleb is the current head of Department of Veterinary Medicine, Ahmadu Bello University Zaria. He is the chairman, Animal Ethics, ABU Zaria. He's also the head of Research and Linkages, Department of Veterinary Medicine, ABU Zaria. In addition, he's the council member of he's a council member in Gombe State University, in University Gombe State, and also a council member of the Veterinary Council of Nigeria. You're welcome, Professor Caleb.
Yeah, Prof.
Thank you.
Yeah, the ball is on your court. Yes.
She just ceased. All right. Good morning, everyone. My Oga Shoyinka. I salute. Today we will be talking about ruminant ehrlichiosis, which, as you will see from my presentation, can we share, please?
Okay.
Or shall I share from here?
Yeah, I think she has started sharing. Let's expand your link.
Sorry. Oh.
Unable to open. You are using iPhone.
Yeah.
No, I'm using an Android.
Let me try and see if I can share from here.
Yeah. Let's give.
Can you see?
Yes, we are
seeing.
seeing.
See now?
Yes.
Okay.
I thought that is mine coming up.
Is that yours, Oga? Prof?
That's mine, I think.
Okay, just do your own. Let's suspend your own. Yes, because we're in Zoom.
Okay. Let me cancel mine.
Let me
Stop
put
sharing.
it in slideshow.
So continue.
Can you see my slides now?
Oh, yes.
Yes.
Okay, so we'll be talking about ruminant ehrlichiosis, And the approach I want to actually bring today is just to look at introduction, epidemiology, clinical science, management, and conclusion. I'm looking at it principally from the clinician's point of view, rather than from a research point of view. So, although you will see the mixture of the two, now you will see some caricatures of different pictures. This, of course, are example of ruminants, which I just put the cow. And this is the parasite within the cell, which is Ehrlichioses. And these are the culprits, which is the tick vector. So it's a vector-transmitted disease, actually. And these vectors are solely responsible in most of the cases in transmitting Ehrlichiosis. And what they normally do is they, of course, attach and they get engorged. When they are big enough, that means they are full of eggs. They drop on the floor and they actually get out their eggs. And it is the eggs that hatched into larvae form, which we'll see later. And the larvae will develop into a nymph, and then from the nymph to an adult. And the adults, when engorged, is the one that produce the egg and drop down to release them. Now, before I go further, I just wanted to look at some synonyms. Ehrlichiosis in ruminants used to be called cowdriosis, for those of us that have studied long time ago. And what they taught us was Cowdria ruminantium is the cause. But when they actually look at the genome of all bacteria, rickettsia, and viruses, the taxonomists came out with different names. I was privileged to work with one of the taxonomists that work in renaming all the bacteria, viruses, and of course, rickettsia. And what they found out is that from the genome, some of the classification we are known to actually differ. So, and they realized after their meeting in the United States that if they decided to change the whole caricature of bacteria, viral, and rickettsia, they are going to confuse a lot of people. Why? Because you find that some viruses have characteristics of bacteria, some bacteria have characteristics of viruses, and a lot of rickettsia are actually bacteria. But they came out with those that are obvious and decided to introduce a subtle change. So when you read different papers or different textbooks, depending on when they were published, you will see that some still refer them to cowdriosis, some call it hard water disease, others call it bone tick fever. All these are applicable and they're referring to ruminant ehrlichiosis. And what is the definition? The definition, it is an infectious, non-contagious tick-borne rickettsial disease of ruminants. Now, I put rickettsial there deliberately so that some of my colleagues will actually understand what we are talking about. However, it is a tick-borne bacterial disease. That is what is defined today. So instead of rickettsia that you see there, you put bacterial disease of ruminants. Distribution, actually, because the ticks love the tropics, you find a lot of them in sub-Saharan Africa. That's the particular tick that causes or transmits this particular agent. They are also found in island of Madagascar, the Caribbean, and the South American countries. These have common thing, which is the temperate, the tropical sense of climate in those areas. And the ticks actually survive very well and do very well in such type of regions. Close home here, that is one of the major problems in South Africa. I don't know why, but most of the cases you see a lot of cases of ruminant ehrlichiosis in South Africa. They have a lot of the tick vector, and the disease is endemic there. However, in our situation, is actually sporadic. Sporadic because you just see 1 or 2 cases, here and there. Even though our tick management is not very good in this country, still, you don't see typical cases of ruminant ehrlichiosis, in the field often. Species mostly affected, you have the cattle, sheep, and goats, and then, of course, you have the wild ruminants. So these are the specific species that are affected by that. So the etiology, as I said, is an obligate intracellular bacterium, which I have shown previously, that is located within the cell. As I earlier said, it's previously known as Cowdria ruminantium, but now it's called Ehrlichia ruminantium. And these are the culprits. They are tick vectors. The major one is Amblyomma variegatum, which is very common here in sub-Saharan Africa. You have Amblyomma habereum. This is the most one that is causing the problem in South Africa. And then, of course, there are other species that you find in mainland USA that is also transmitting this particular organism to ruminants. So really here we are busy with Amblyomma variegatum, but don't be surprised to find Amblyomma habereum here. And I'm sure there are some studies that have isolated them. The major reason it was because of animal importation, etc., that have resulted in we actually having newer things in this country than we have bargained for. Now, this is just to show you the basic life cycle of how the tick actually gets into on the animal and causes the disease. First, you have the engorged female, and this engorged female lay her eggs on the ground. The eggs, from conducive condition, hatch into the larvae. Now the larvae attaches to the first animal, gets some blood meal, drop and develop into the nymph. Once it drops, this nymph attaches to another animal, takes some blood meal and drops. This tick become matured now, and then attached to the third animal. That is when it got engorged, lay eggs, and when it is heavy, it drops, and the cycle continues. That's actually what happens in the field. And within the tick, what really is interesting is that you have 2 forms, the reticulate bodies and the elementary bodies. The reticulate bodies are vegetative forms. These ones are non-infectious, they don't cause disease, but the elementary bodies are the one that the infective form. And normally they develop inside the gut of the tick. They develop inside the gut of the tick. And then, of course, every lining of the salivary gland, they are regurgitated. And during feeding, that is when these elementary bodies actually are injected into the different cells of the animal body. It could go into the monocytes, it could go into the endothelial cells, and it could go into the neutrophils. And these ones are carried actually to their predilection site. So these bodies within the cell actually changes to become the elementary bodies, and these are the infective forms. And once they burst inside the proliferation cell, they can reinfect other susceptible cells, and the cycle continues until they find themselves into the blood vessels and they're transmitted to the brain. So that's basically the life cycle within the ticks, which means that within the ticks, actually, the parasites develops and become infective. What are the signs? There are three types of forms of this disease. You have the paracute, you have the acute, and then you have the chronic. The paracute and the acute are the most dangerous ones, because once you have them, it's very difficult for you to say you can treat. The animals will die, especially in the case of paracute. You just come and find the animal dead. The only way you can confirm that they died from Ehrlichioses is to take either brain tissue samples or blood vessels, make your smears, and see if you can find, the parasite within cells. In the case of acute, you start seeing anorexia, listlessness, and then congested febrile mucous membrane. And before you know, the animal will start giving up. In the chronic form is the one you see typical clinical signs in the field. Most ruminants will show hyperesthesia. You have high stepping gait because it's in the brain and it's causing some nervous signs. You have exaggerated blinking and chewing movement, prostration, bouts of opisthotonus. Then the animal will be recumbent. You have paddling, thrashing, and stiffening of the limbs, and seizures. In some cases, you see diarrhea. And I think the diarrhea is just because of the excessive movement within the system. And that's the typical one you see in the field. Even with that, you know that there are so many other diseases that can mimic this. And when we look at diagnosis, we'll see this is just to give you an example. You can find an animal just dead the next morning. That is the case of acute. This is in sheep and goat. And this is a big dairy cattle just dead. And this is an animal that is just being infected in the chronic stage. Just to show you the different plane of the disease in the animal. Now, diagnosis. The first indication is sighting emblematics. If you sight emblematic on any of the animal in the herd, there's every chances that you're dealing with ruminant rickettsiosis. And the other thing you will do to examine, to find out what is wrong, these days we have quantitative real-time PCR, and you look at the gene PCS20 specifically, it will tell you that you're dealing with rickettsial organism. The other diagnostic method is histological examination, when you demonstrate the organism in vessels of dead animals. Then you have serological tests. This is not very useful for individual animals. However, if you're looking at the totality of the herd and you want to look at the prevalence or the rate of occurrence of that organism, you can do serological tests, which is ELISA, and it will be able to tell you that you are having the telltale sign of rickettsial ruminantium in these animals. However, the easiest one is the impression smear that you make in the laboratory. Once you get the brain tissue, you can make smears on slides, stain it, and that's the easiest way for you to identify the rickettsial organism within the brain tissues. And that will tell you that that animal actually dies from ruminant rickettsiosis. How do you manage this? This disease, even though it's very severe, thank God, we have an easy treatment, which is the tetracyclines, 10 to 20 milligrams per kg. If you give IV, it is faster and better because it will reach the site of action, especially in blood vessels, and deal with the organism. If you give IM, it will take a very long time before it reaches those sites. But in any case, you can only treat if the animal is in the early stages of the infection. Because once the infection has settled down, it has reached the brain, the only thing you can do to that animal is to salvage it because the prognosis is very poor. Other drugs you can use sulfonamides, 15 milligram per kg IM, not very effective, but it can still be used. And to control some of the nervous signs, you give diazepam, 0.2 to 0.5 milligram per kg IV, just to settle the animal. And you give it repeatedly 10 minutes interval, not more than 3 doses. You can give steroids, that's supportive care to reduce some of the inflammations in the brain. And then you keep the animal in a quiet, cool place, because one of the funny things about the disease is that it does not like noise. With noise, the clinical signs are exaggerated. So the animal needs to be taken to a very quiet place where there is no any external stimulus that will cause it to actually get engaged into its nervous signs. So these are the easiest way of managing this. But as I said, once the clinical signs have manifested, forget about it, salvage that animal. Control and prevention. At the moment, there is no vaccines. So work is in progress. The only way we can prevent this disease is tick control strategies. And any herd or any flock that we have, one of the best way to actually control is to have our best tick control strategies. People will tell you that you need to maybe control ticks 4 times a year. Others will tell you 6 times a year. Thank God these days we have the porons that are quick, even though toxic, but they are very quick to take care of our ticks and the animals will be healthy. The other thing I wanted to mention here is that because of global warming and because of the climatic changes, what you realize is that the population of amblyomma ticks, especially around northern Nigeria, is reducing. And most of it is being located where you have lush grazing areas, where you have marshy areas, and around water bodies. The reason is because of the high temperatures and harsh environmental conditions and a lot of bush burning, etc. A lot of these ticks have metamorphosized and moved to areas where they can survive. So if somebody is grazing around water bodies or around lush areas, they are actually important for them to take tick control strategies, very, very important. Now, in conclusion, the disease is an acute, fatal, non-contagious because you cannot transmit it from one animal to the other. It has to be by tick. It's tick-borne bacteria, formerly known as Rickettsia, infection of ruminants occurring in sub-Saharan Africa and the Caribbean. It doesn't mean that it's not present in the Americas. It is, but it is, what will I say? It's not endemic. It's just occasional occurrences that you see in the Midlands of United States. It is characterized by sudden fever, neurological signs, high mortality rate, especially in small ruminants. Diagnosis is based on the presence of the infected vector, or you can do molecular identification of the pathogens. As I said, you can also make some smears and stain them and examine them in the laboratory. There is no effective vaccine against this disease. Control is based on preventing infestation by ticks, especially the amblyomma tick. So thank you very much. This is the little I have on ruminant Ehrlichioses. I await your questions. I can't hear anybody. Hello?
In the chat box, if you have a question, maybe raise your hand.
Mm-hmm.
If you have a question, please can you raise your hand so we can give you
Or
audience, give you
or comments, or comments.
Or comments, yeah.
So, but before then, do we have chemical pathology on this, Prof?
Yes.
Do we have chemical pathology on this, and then real pathology, micro pathology, sorry, histology and gross pathology?
You do have gross pathology, and most of the things you see actually are real congestion of most of the organs and tissues, highly congested. But it's typical of most other diseases that you can see, but you cannot pinpoint except if you are able to identify the ticks and you are able to identify the parasite within or the bacteria within the slides or by PCR.
Okay. Then how about chemical pathology? Is there anything like that?
No, I'm not aware of any sample you can take apart from the one you take to parasitology for slides. You take blood samples, etc. But no.
Okay.
Except if you're interested in seeing, I'm sure Professor Shoyinka will shed more light. If you're thinking of looking at the tissues and what actual pathology develops due to the congestion, then he might throw in some light there.
Yeah, Professor
It does
Shoyinka.
not help. Does not help in diagnosis per se.
Okay. Yeah, Professor Shoyinka, please, can you assist us a bit here from your angle in your practice in southern Nigeria? Do you have yeah, you unmute yourself and then let's see. Professor Shoyinka. But before then, somebody is saying, Ifan Yobu is saying, is this a zoonotic disease, Prof?
Ehrlichiosis can be zoonotic. The interesting thing is that what I have not mentioned, because we specifically focus on ruminant ehrlichiosis, is that it affects an array of different animals. Okay? We know obviously the one in dogs, and then now the one in ruminants, and it's because of, the attachment of the ticks. And if perchance, man is an accidental host anyway. So I don't think we can classify it as zoonotic. But if you say, could it affect humans? There is a possibility there.
Yeah, Haruna Dentes, unmute yourself, okay? Yeah, you can ask your question or whatever you have.
All right. Good morning, Prof.
Morning.
And thank you very much for that very explicit explanation on this very condition. First, let me start by congratulating you on your election and the inauguration as member of VCM.
Thank you.
Well done, sir. Prof, my concern is this issue of vaccine. Since there is no vaccine so far for ehrlichiosis, and you have mentioned in the course of your presentation that tetracycline is a drug of choice. Looking at the clinical presentation, since paracute and the acute forms are deadly, and before one could realize the patient has gone, can one advise, or can you please shed more light, can one use tetracycline prophylactically as a means of preventing the disease from coming in, knowing fully? Let's take, for instance, if the environment where one is endemic with ticks, can one take that measure, administration of tetracycline as a prophylactic measure in controlling ehrlichiosis from coming into a heart? Can you shed more light in that, please, on that?
Okay. Personally, I won't advise it.
Okay.
Because just injecting antibiotics into an animal just like that, for prophylactic is really not recommended. what is actually recommended is for you to control the ticks. Why wait and start giving tetracyclines when you can just control the ticks and avoid the infection? Because when you see where you get this acute and paracute, their tick control, especially amblyoma species, is very bad. And because of that, they get cases of acute paracutes, around. So definitely, I won't advise prophylactic use of antibiotic for treatment. We are trying to move away from overuse of antibiotics. So I think we should not just continue now.
Yeah.
I hope I've answered your question.
Yeah.
Yes,
Somebody is asking, can auscultation be a means of diagnosis?
Auscultation.
Mm.
Well,
Because
because it's called heart water disease, because of the issue, you have accumulation of fluid, around the heart. And if you auscultate, definitely it will tell you something is wrong in the chest cavity. And that is just used as a diagnostic aid. But as I said, for you to be sure that you're dealing with ruminant ehrlichiosis, you have to identify the tick. And secondly, dead animals, you have to isolate the organism, or you can do PCR and isolate that gene to see that that animal is suffering from that. So occultation, yes, can contribute, but it cannot, because there are so many conditions that can cause hydrothorax and hydropericardium in ruminants.
Yeah. Thank you. Thank you very much. And for those who are looking for, somebody is asking before I get there, somebody asking, is it the larva of the ticks that causes the disease? Or can one say ticks are vector of the disease in question? Is it the larval stage, the stadial stages, or the adult stage?
Well, it depends. It depends on the nymph actually is the newborn, okay? And because this bacteria actually is indwelling within the gut and within the salivary gland, there is transovarial transmission sometimes. The nymph will carry the organism. Okay. Remember, the nymph will attach to the first host. It will suckle blood, and in the process of suckling, the tick regurgitates. And if the organism is present within the salivary gland, the organisms are transmitted into the host. So it could occur at any stage, either in the stage of the nymph, in the stage of the larvae, or in the stage of the adult, because they're different hosts.
Yeah. Another question here, please, again, how endemic is ruminant ehrlichiosis in various regions of Nigeria?
I'm not sure in the southern part of Nigeria, but in the north, it's very negligible. You hardly see it. And that's because of the global warming that I have mentioned. I remember when I graduated, actually, that was my first challenging case. And a huge breeding bull had cowdriosis. From the lectures, we were able to identify the tick. And by then, it has started showing all these nervous signs, the chronic stage. We tried to remedy it with all the treatment, but the animal died. So, but now you hardly find cases of ruminant ehrlichiosis in the north. Basically, it's because desertification have actually moved down to the Guinea savannas that we think we used to have. And that is due to global warming and due to unnecessary destruction of trees, etc. Even in the south, there's some element of global warming. However, I believe it's a possibility because the condition is conducive for that tick. So maybe clinicians that are down south need to be very observant in terms of that disease. Because most times we wake up, we see animals dead, we do postmortem, ehrlichiosis don't come to mind, we think of other diseases, despite the fact that we are seeing amblyomma ticks on the animal. So I think it's something we need to start looking into, because really, as I said, it's not very endemic in Nigeria, it's just sporadic, but it's deadly. You can imagine if you have a dairy cow that is producing 7,000 liters of milk per lactation, for example, and you're losing it within seconds, it will really be painful to the owner and loss of large amount of money.
Thank you. Abiode is saying, Kunle Abiode is saying, please don't, please let us not use antibiotics for prophylactic.
Absolutely.
Yeah,
I agree with
just
you.
in sync with what Prof had said. Well, more questions, more comments, so before we'll round up.
There's a question from Dr. Gloria Karanye. She's asking, she says that there are a lot of amblyomma ticks here in Jos. Can we diagnose this disease by crushing mature ticks? We see a lot of clinical signs that mimic this condition on the clinic floor. So, Prof, she's asking you this question.
It's really difficult because you have to look for the infective form and the vegetative form in the ticks. That is the only thing you can see within the ticks. Maybe when you do PCR, you'll be able to detect that particular gene that I'm talking about. So you can use ticks using PCR to be able to get the parasites. But that does not translate into the disease, because just because the tick is harboring it does not mean that during the regurgitation, those organisms are actually entering the host. Remember, the host has its own defense mechanism. In the first instance, it depends on the dosage of the bacteria that has been injected into the animal. And it depends on actually the surrounding condition, environmental conditions as well. So crushing ticks will only tell you if the tick is carrying it, but it will not tell you if the tick is transmitting it. It's only when you check the animal that you can be able to diagnose the disease in cattle or in sheep and goats.
Yeah, brilliant.
I hope I answered that question.
Yeah, Terry, unmute yourself. Well, yeah, good. Well, we need more questions and see how far.
I have a question, Prof. I have a personal question. It seems this canine ehrlichiosis is
this ruminant ehrlichiosis.
Ruminant ehrlichiosis. It seems it's more deadly than the canine ehrlichiosis and less endemic, because I know canine ehrlichiosis is more rampant. I know I see a lot of cases.
It's very common. It's very common. Yeah.
I saw a case of canine ehrlichiosis, but that of ruminant ehrlichiosis, I've not really come across it. So is it more deadly? It seems like once the clinical signs have manifested, there's really there's not much that can be done again.
Actually, they are all deadly. Even the ones in the canine ehrlichiosis in dogs, they are all deadly. One of the things you should remember, in addition to the nervous signs you see in ruminant ehrlichiosis, is the fact that the organism actually occupies mostly the leukocytes, okay? And all the cells that are supposed to fight, the neutrophils that are supposed to fight the infection. You get me? And once they do that, they actually bring down the immunity very low. And once the immunity is low, especially in canine ehrlichiosis, what they do is that you find out that there is problem with the circulatory system. And most of the time, what kills the dogs, I think, is the failure of the heart actually to pump blood around. I've lost some dogs due to canine ehrlichiosis, so I'm very much aware of that as well. But in case of ruminant one, we are fortunate, and the tick vectors are different. You know,
Yes,
the tick vectors are different. So I think we are fortunate in case of ruminant ehrlichiosis that the amblyoma is not something that you see them commonly, but they prefer lush, slightly cold conditions to be able to replicate successfully. And that is why it is a bit easy for us now in the North. When I was a student, we see the cases almost every week in Ahmadu Bello University Clinic. And we do postmortem, we do brain smears, we do everything. And, you see the parasite in circulation. So, I mean, within the slides. So really it is, they are all deadly. To answer your question, they all kill. Our only issue with the ruminant one is that they're sporadic. You don't see them always.
Okay. Okay, sir.
There's
Then
another question, Terry. Terry, there's another question from Adamu. Are you saying it?
Okay. Dr. Adamu. Okay, Dr. Adamu wants to know the major difference between cardiosis and ehrlichiosis. Like they exhibit some signs that are similar. I think.
Well, I've explained it earlier in my in my presentation. Cardiosis is the old name. Ehrlichiosis is the new name. So, and it's because, and cardiosis, if you read what they say about cardiosis, they will tell you it's a rickettsial organism. But when you read about ruminant ehrlichiosis, it will tell you it is a bacteria. There's some change that occurs, from the late 80s, to date. That is why it is now referred to as ruminant ehrlichiosis rather than cardiosis.
More questions? Begging for answers.
One question, please, if you don't mind.
Yeah, Dr. Adamu is thanking you, Prof.
Oh, thank you.
I have another question, Prof.
Yes, ma'am.
In canine heliciosis, usually we see nose bleeding. I want to ask one, for ruminant heliciosis, do you ever have a situation whereby there's also nose bleeding? And two, what is the pathogenesis of that nose bleeding? How does it come about? What leads to it?
Okay. In ruminant ehrlichiosis, you hardly see nose bleeding in clinical cases. However, sometimes when the animal is dead, you might see a slight tinge of blood coming through the nostrils. The animal is already dead in cases of paracute and acute. The pathogenesis is simple. Remember, these organisms multiply within the epithelia. And especially in dogs, the epithelia is in the surface of the nostrils. And when they find themselves there, they technically burst the vessels within the nostrils. And that's where you get the epistaxis that you see.
Okay.
So they are in the gut. From the gut, they translate into all these white blood cells. Those blood cells are taken in circulation. They love the endothelium. They find themselves there. They multiply from the vegetative form to the active form. And during the process of this multiplication, you might end up getting some slight discharges coming out from the vessels that are superficial. In the cow, it's more interesting because it goes to the brain rather than, the other blood vessels. Not that it doesn't affect other blood vessels, but it goes there as well.
Yeah, there are some questions from when you finish, Terry, from the YouTube, because we have two channels.
Okay.
Coexisting here. I don't know, Terry, do you give me the permission to go on the YouTube questions?
Yes, sir, please go ahead.
You know you are the moderator in chief today. No, the kind of moderation we have here is generational. You can father Terry, and she is moderating you. You want to break down some walls, and you are lecturing in ABU. She is lecturing in UNN. We want to break down some walls. And then we are male, she's a female. We are breaking walls. And we're putting up a platform whereby we can have all these differences, all these variations, and putting them together into a research. Whether you are UNN or you are UDUS or you are ABU, you can have link. You know, you are practicing, Prof, in the north. She's practicing in the south.
Yeah.
There are some kind of semblances or resemblances and no semblances here and there, which you can all mix up together. This we're in a country. And I even sue and pray for regional, coastal, West African coastal research linkages among the universities, along with ECOWAS region. I even, you know, Nigeria is almost in Central Africa to some extent.
Absolutely, almost, yes.
You can look the other side in the east of Africa and west of Africa, and do research linkages that can come up with facts of research. Now, question one is, which has been answered, human ehrlichiosis has been answered. And another one is, also, does cycline used in canine ehrlichiosis, can it be a drug of choice in ruminant ehrlichiosis?
No.
No. Then he said, I think it's possible that co-infection of babesiosis and ehrlichiosis can make ehrlichiosis to be misdiagnosed and underreported in Nigeria. From the YouTube.
It's a possibility. I remember, you know, my early career, you always get these mixed infections. And diagnosis is always an issue when it comes to ehrlichiosis and babesiosis. But the blood picture will actually help in differentiating, and you get mixed infections actually in those days because the tick populations were very high. And as I said, you know, since returning from the UK, and I am in the ambulatory section in Ahmadu Bello University, so we really go out and we look at animals. One thing you looked at is that you will see that the tick populations actually in most of the areas are kind of reducing, and you start wondering what is happening.
Yeah.
And you know that people are not having very good tick control. So you can only associate that with global warming. So really, it is possible to have mixed infection. But in case of rickettsia, I mean, ruminant ehrlichiosis, one of the major issues you see is in most cases, you see the acute and the paracute occurring. That is before you know the animal is dead. It's only when you did postmortem and take samples and do some examination that you can confirm, or when you see the amblyoma tick on the animal. However, the chronic stage is very classical. And as I said, it's very sporadic. So you can't miss it for babesiosis. That's just what I'm saying. But when you do laboratory examination, yes, it is possible to find misinfection. And one may exacerbate the other, depending on which one is in large quantity.
Yeah, another question is, do sheep show lameness and ataxia symptoms as seen in canine ehrlichiosis?
You say, does sheep show what?
Lameness and ataxia as symptoms as seen in canine ehrlichiosis.
There is ataxia, both in cattle and sheep. There is ataxia before you have recumbency. And of course, you will see all the nervous signs as well.
Yeah.
So yes, they all show it. In fact, it's more severe in sheep as it is in cattle. The disease is more severe in sheep than in cattle.
Yeah, David, I decided to say, Uchendo, right on, sir. You are doing well. And these are snippets from the YouTube. And then I decided saying again, David Oluwaseun, I decided saying, we thank you greatly, Prof, for this wonderful delivery. Prof is always a Prof. I think Terry, when you finish, Terry Nzako would maybe throw some lights on the entomology, the ticks, and whatever is going on in the southern Nigeria, in the east.
Yeah, sure.
Don't worry, Terry, that coffee will drop from your hand soon. Just don't worry.
It's actually lemon tea.
I know, don't worry.
Before I talk about the ticks, I want to just take a few questions from the chat here on Zoom. So, Sylvester is still asking about diagnosis, if it can be done from the ticks, and I think Prof has answered that already. Prof, maybe Sylvester, you may need to go back and watch the video, or Prof, I don't know if you want to still say something about that.
Yeah, the
I know you talked about
the video is streaming in YouTube. You can see people are watching it from YouTube. And we're going to pass it again so that there will be a dress rehearsal, will be a rehearsal of knowledge.
Okay.
This,
then Dr.
I think Dr. Tuju Nasi said in the YouTube that this is a classic presentation.
Yes.
So please,
Okay.
As the owner of the link, please, we plead with you as you're watching, be subscribing to us so that we enlarge our space and they're able to travel. The algorithm will assist in making the YouTube to go far and go viral to our corporate advantage. So please, just when you watch it, those in YouTube, please click the subscription and notification sign button so that when next we come on, it will just notify you. We have a lot of lectures. This year is, I'm telling you, like next week, I'm going to bring, or next week or next 2 weeks, I'm going to bring classic mentorship class. Mentorship class. Abiade is here. I've recognized him. He will be part of that. The national NVMA president, I'm going to call him on board. And the dean, faculty of veterinary medicine, University of Ibadan, I'm going to call her on board to represent the academia. And then maybe from what we're able to discuss, they will know what that look. There'll be some gaps. They'll be able to notice some gaps in trying to train students who come out and not having their way to shoot that. I'll be part of it, no doubt. And then Dr. Chika Ikogo will be part of it. So we'll be able to see what our mentorship drive, how far it can go to be able to bring us up, because really what we found out is the courage, charisma, comportment, competence, they all blend together to give you what you have. Based on my strategic trajectory and my history of starting veterinary medicine from youth service, private practice as a pedestrian ambulator. And I think I should be able, and we all, and Abiade, we all should be able to give to the younger ones on how to grow and how to build up themselves. But above all is the confidence and comportment. And then the training. Anyway, I don't want to go to what I'm going to discuss. And the advice we are going to give the faculties on how to bring up the students so that when they come out of the university, they don't come out from as point of naivety. They'll come out as point of comportment. Even be it that it's may, then questions. You have some questions again, Terry. So you have some questions, Terry, from the chat box.
Yeah. Yes. Prof has also handled this. Dr. Ola, he said, well done, Prof, for the presentation. It seems that once clinical science is being manifested, the prognosis is guarded, Prof. Is it also advisable to inculcate also tetracycline prophylaxis? And the answer is no.
No. Yes.
I antimicrobial resistance.
I think colleagues, yes, we need to be careful how we use antibiotics, honestly. Some diseases or some conditions are based on management. And if we have effective management, we don't need to use any chemical in the animal. So we need to be really careful on how we handle. I know it's easy way out, but definitely we are creating a bigger problem rather than solving the problem.
Okay, then this is a comment from Dr. Adekoke Samuel. So he says, Prof, we need ranching for mechanized, we need mechanized arable farming to be achieved nationwide so that crops will be surplus for human and animals. I think She's just trying to say maybe if we reduce the way animals graze or something, we can help reduce their access to these ticks and thereby prevent canine ruminant ehrlichiosis. I don't know if I passed the message properly, but I think that's what he's trying to say from his comment.
Yeah, in our retrospect, we need to build our ruminant system to be at least to be semi-intensive. The extensive system might be there because it has been feeding us, but you can still do convert extensive, those owners of animal from extensive to semi-intensive, and then from there to intensive. I think that should be the trajectory we should go. Prof, thank you very much. People are commending you, Prof, and then
thank you, sir.
People are congratulating you for being in the Veterinary Council of Nigeria. Because I'm not a professor. Because I'm not a professor, nobody is congratulating.
No, you are a popular face now. Everybody knows your struggles.
Because
you have been doing it for a long time.
Now, in all preferences, they prefer you to me. So, and they have.
Well, you had more votes than me. So, if we were to go by that, you are more popular than me.
Waste time of a glimpse.
Yeah,
sorry.
Ola is saying something. Please, Terry. Please, let's go.
Haruna.
No, Ola. Okay.
Do I unmute?
First, Professor, please, questions and answers.
Okay. Ola, where are you? Okay, Dr. Ola.
No, go to Haruna. Go to Haruna.
Okay, Haruna, you have the floor.
Yes, I said, Dr. Charles, this is my first time of seeing you live, and it's an oversight. Congratulations too.
No, it's not an oversight, it's an afterthought.
The boy is a politician.
Oversight. In between oversight and afterthought, I think I would take afterthought.
I've been following Dr. Charles, but this is my first time of meeting him close on online like this.
It shows that you have not been coming to the Congress. You know, you are an indoor vet. Because if you are coming to Congresses, you would have seen me.
Sorry.
Yeah, it's okay. You're welcome. Where are you based, sir? Ruminant.
Makodi.
Oh, you are in Makodi. Were you there I presided the NVMA conference in Makodi. Were you there 2010?
No, I wasn't there. I joined the university in 2019.
Okay, were you a NIMS at that stage? Were you in the Morula stage or Gastrula stage or embryonic stage or being a vet?
Not a young vet. It's just that I've been in hibernation for some time.
Okay, please, we need to break you out.
All right.
You're welcome.
Yeah, sorry, Charles. There is a comment. Somebody said, I think the ticks population is still high in parts of North Central and in the Southwest Nigeria. Cases such as described and sudden death, of course, in these areas. I've seen quite a few too.
Okay.
I just wanted to respond to him. Yes, it's possible for you to see, as you specifically said, part of North Central. Because the truth is that desertification has entered even Guinea Savannah. And you see less tick population as you see before. So definitely, because of climate change, some of the vectors are moving southwards. So most of the diseases we used to see around the north now are supposed to be manifesting around the south. So really, southern clinicians need to watch out, because definitely you will come in contact with that. The ticks are there, the animals are there, and the next thing you expect is, and it's not all cases of sudden death you can ascribe to ruminant ehrlichiosis. You have to dig deep and know what your differentials are. We need to be careful not to just see sudden death and say it's ruminant ehrlichiosis. If you find the amblyoma tick, that one is almost certain. If you don't find any tick, it's something you need to really reconsider. Thank you.
Yeah, thank you, Prof. Yeah, but But from my own experience in my farm where I keep some few sheep, my experience is that during the rainy season, just like all other vectors, there's a build-up of tick population during the rainy season. And then we know we have more rain. You know, if you go to Lagos by where you're supposed to have harmattan in the north, you wake up in the morning,
it's raining.
It's raining by December.
Absolutely.
That will tell you the geographical climate of of Nigeria, the variations. But that's okay. So who again? Cherry, please.
Okay. There are no other questions. So I just want to make a comment because people have been asking of prophylaxis. I think the best prophylactic approach will be to control ticks.
Yes.
To make sure that these animals free from ticks. That's the best approach that we can use. So we have the pour-ons, we have
Is that all you tell us as entomologists? Oh yeah. We want to learn.
I said it all. So the autism is transmitted by ticks, Amblyomma ticks for the ruminants and the Rhiphocephalus for canines. And the best approach for prophylaxis, I would say, is to make sure that these animals don't have ticks on them or a history of ticks. Because the case I saw last week, even though the dog doesn't have ticks now, but he had ticks last week, so the ticks had already injected the organism into his bloodstream. So the best approach is to make sure that we keep our animals tick free. And if we notice anything, early diagnosis is always very important in any treatment. Start early to have a tentative diagnosis, differentials, take samples, analyze these samples, and find out what the diagnosis is. So you have better prognosis if the disease is diagnosed early. That's what I feel from the pathology point of view.
Thank you, Terry. Somebody saying.
Yeah.
Somebody is saying something. Adegoke is saying something from field case he handled.
Okay. Dr. Adegoke says the case I handled in a farm in Ofa, Kwara State, clinical signs, presence of ticks heavily on the body of cattle and sheep, tentative diagnosis, Ehrlichioses, babesiosis, no vet acaricide to get rid of ticks, and agricultural acaricides are toxic to the ticks. Yes, please don't use what is meant pesticides. Actually, they're not acaricide, pesticide. The agricultural ones are pesticides. Please don't use them on animals. And you have to make sure that what you use are the safe acaricides, like the fipronil and some other acaricides that you can use to handle ticks. I don't know, Professor Kudi, can you say something about this? Can you say something about
herbicides are meant for grasses, so they are not meant for ticks.
No, I don't think they're talking about herbicides. I don't think they're talking about herbicides. They're talking about pesticides. The one they use against.
So if you are talking about pesticides, most of what people use, which actually I'm against, is the old organophosphates and organochlorines, and they themselves are toxic. A lot of people use them in sprays, and I don't know why we're still using them when other worlds are not using them at all, because there are many modern ones today that we can use that are not as severe as organophosphates and organochlorines, because if you make any slight mistake, you are destroying the animal, not solving the problem. Even the pour-ons, you have to be very careful. In my practice, I went to one of the farms, and one of our colleagues from the paraprofessional side, used pour-on in excess. The animal licked it, and before you know, out of a herd of about 50, they lost 25 straight away. So we need to be very careful on how we even use the drugs. Please, let's read the label very well. If we don't know, let's ask our colleagues that have used it before, and so that we can get it right the first time. Thank you.
Yeah, my warning here. I have visited 2 clinics during the course of my trading escapade. I have seen 2 classical cases of German Shepherd. They, all these spray. They went and they did concentrated chemicals, EC chemicals. These people dilute it, call it otapia. They would dilute it to their own dilution spot, and then put it in all this spray. These things you use in spraying grasses and spraying here and there, and be selling it as stickycides. And I've seen dogs come down with serious, severe
toxicosis.
Yes,
Yeah.
serious toxicosis. In fact, there's one, the dog handler, the owner was slapping the dog owner. Sorry, the dog handler for using such chemical. But anyway, vets, in 2 cases, they were able to revive those animals. And if not that they took them to veterinary clinic immediately, they would have won that those 2 dogs. German Shepherd. I think German Shepherd is vulnerable to all these toxicosis. The 2 of them I've seen they were all German Shepherd. So one, we have to be careful. Vets, you have to be careful. It's not whatever you see. Look at the, not like Prof is saying, look at the manufacturer's prescription. If they don't have manufacturer's prescription, and don't use the crude ones. That's the thing. It will kill ticks, agreed. Those pesticides, they might kill ticks, but they might kill your animal for you.
Yes.
And most of those that has high absorptive capacity into the bloodstream, one has to be very, very careful. From one thing, we can bring up a lot of issues. So, Terry, have you finished so that we can move on?
Yeah, just a question from Dr. La. He's asking Prof. He said, I think permethrin derivatives are still safe, right?
Yeah,
Yes.
I gave the answer, yes, on the chat. Yes.
Yeah. All the ones that enter metrin, all the metrins are good. I think that Prof, I think they're botanicals or biologicals. Is that what they call them? They're biologicals. They're biologicals, yes. They don't enter into the bloodstream. No. And they are very good.
Yeah.
The withdrawal period is almost 0 for food animal.
Yes.
Yes. Almost. At least we traders, we read the label once in a while. Buy some read journals, we read label. We read postology.
It's allowed.
The point is that we have the knowledge. Okay. Yes. So any other comment? And Dr. Leis, I've known you as a quiet human being. I don't know. Such people like you are difficult to teach in the classroom. They don't say anything. They just go. They just are here. Did you have anything? Okay. If we don't have anything, Professor Husina is here. Dr. Abiade is here. Professor Soyinka, Professor Agnes Wanena, and then our lead presenter, Professor Caleb Kudi, the much more recognized elected member of the Veterinary Council. He was my senior, and I bow down for him. And an agent of seniority. He so much believes in seniority, and he's an advocate for junior vets to respect senior vets. Honestly, in all calculations,
that is what the profession is founded on.
Yes, honestly. And, Dr. Abiade, do you have anything? Though this is not Ruminant is not your area. Do you have anything to say here? Dr. Kunla Abiade. Abiade, do you have anything to say? Is it there? Sometimes he has.
Yes, it's still there.
It's muted.
He's muted. Can you mute yourself and then? Ah, my God. Who again?
Might be busy.
It might be busy. Professor Agnes Nwanenna, do you have anything to tell us? Professor Agnes Nwanenna, unmute yourself, okay? Alain Risenchi said, say credit to me. I thank you back. I love you too. Who again? I think there are 7 messages. Okay, now thank you. Senchi said, thank you, Dr. Ibe. I thank you too. Thank you so much, my super. Caleb, your children are here. Gloria,
I know.
Say that.
I know.
Say that
I can
you are,
see them.
eh?
I can see them.
Yeah. Caleb's Karaye, sorry, Gloria Karaye said that you are her supervisor at ABU. Wow.
That's right.
Oh, that's okay. That was Emmanuel Chikwe is here. Associate Professor Chikera is here. eBay. But we have catalog of vets here. Please, when we recycle this, always endeavor to click our subscribe button and the YouTube and notification button. Next week or in 2 weeks' time, I will gather and compact a group of vets that will come in here to mentor us, teach us the way to go. I think we're having some fundamental and foundational problem on where to go immediately after our school. I saw those problems when I came out of school, but I braved to some extent. I fought it. And maybe that's why some people say that I'm a mad person. Because if hunger had caught you the way it caught to me immediately after my NYSC, if I am sane, that means I'm not normal. Hunger can push you. Hunger cannot supervise Paul Amota is here too. Prof, are you supervising everybody in ABU?
Well, those that come my way.
Anyway, so the kind of hunger I fought when immediately after I finished my NYSC. If I am sane, that means I'm not a normal human being. Hey, let me just tell you, everybody, I saw hunger, I fought hunger. And we must all unite against hunger. And part of my fight in the council is how we will deal with endemic unemployment in our space. Very
good, very true.
And how we can be self-employed, and how can we expand our scope, enlarge our scope, and increase our absorptive capacity. That's all I'm there for. Any other thing, I'm not there. Those in research will deal with the research, like Professor Caleb Kudi. But those who are traders like me will deal with trading. So everybody has his own space to occupy. And our council has a good space for everybody. With police, we have those in private, we have lecturers, name it. On every divergent area of our practice, we have people. So let me thank all of you for giving me, this is the 3rd time I'm in the council. So that means if I'm alive for 15 years, I'll be in the council. For 3rd time, they don't consecutive. The first 2 are consecutive. After a break from 2013 to 2025, I'm elected again. Thank you very much for giving me that opportunity. And I'll fight. And then pray for us, because if your prayers are not answered, you don't pray enough, we might not perform enough. Professor Kudi, are you hearing me?
No, I agree with you.
Yes. So we want you to pray enough for our health, Terry. We pray enough so that we can speak good English. Pray enough that we can galvanize our way through, so that God will act enough. But if you don't pray enough, God didn't act enough, we might get there confused. Drink tea and coffee and go. So that's all. So I think at this juncture, let me see whether we have 1 or 2 comments. Sorry, those in the YouTube. Let me see those in YouTube. Well, I don't think there is much again to deal with in YouTube. Let me see. Well, we're almost at the tip of it. We're 21 right now. We got to 28. Let's see. Let me see. I'm trying to see whether we can bring out some comments from the YouTube. Okay, let me see. Well, no more comments as far as I'm concerned. And then we thank ourselves. Ulabia, they will call you. Can you unmute yourself and talk to us? Well, I think on this platform, Ehrlichioses, Terry Jacob, Aruna Dente, Yunus Wahab, Adegoke, Abdulaziz Olayiwole, Paul Amuta, Ifeanyi Ogbu, Gloria Kare, Helene Oputa. Helene Oputa is in the VCN. Innocent Elizu. Is it Awo? This one is Awo root. Is it Awolowo root? Adewola Fatola. Fatola, I need your number. Those dogs are fantastic, honestly. Maybe we might strike a deal. I'm a deal man. No. Okay. Thank you very much, Prof. You can see
Thank
that
you so much for having me.
Well, and we ate well.
Thank you so much.
I think at this juncture,